You are watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, men and hormones, hormone optimization. With us, we have an expert on the topic, Dr. Farnesi. Dr. Farnesi, welcome to the program.
Thank you very much.
Now, for people that don't know you, tell us a little bit about your practice in San Diego. Who's the typical patient?
Typical patient, practice is split between men and women. I'd say maybe 60% men. I work in the Hillcrest area, so we have a large gay population there, and they tend to find me. And the typical patient is anywhere from, say, 35 to 85 years old. And it's amazing. The difference is kind of sad, actually, scary, that the 30-somethings are starting to experience hormonal decline and functional medicine issues at such an early age. I think if you look at population studies, hormone imbalances and nutritional deficiencies and environmental toxicities starting to happen to people at earlier and earlier ages. So my population is getting younger and younger, which is fascinating.
So like what age? Like 38?
Yeah,
years old?
Mid to late 30s.
And then what about the high end?
The high end, we got our 65 to 85-year-olds who really maybe didn't take advantage of anti-aging medicine because it wasn't around when they were in their 40s and 50s and going through the menopause or andropause transition. And they're now looking for a better quality of life, either because they've seen it, read about it, heard it. I've got the guy who's 77 who wants to still surf. I've got the guy who's 80 who wants to ski mogul still. I've got a dentist who's 73 who runs circles around the 20-year-old dentist in his practice, and he likes that.
Okay, so let's begin with, because you call it, what your background and training. We should mention that first.
Oh, okay. So I'm board certified in family medicine and then anti-aging medicine through the Academy of Anti-Aging Medicine, and I've completed now their advanced fellowship in anti-aging, functional, and regenerative medicine.
Okay, good. Okay, so men and hormones. What are some of the symptoms? I mean, when should a man do something about it?
I would say as soon as they start seeing that something is off, and the big symptoms that we see are lack of energy, declining sex drive, depressed mood or lack of self-confidence. That's not one men like to talk about a lot, but it really does affect them.
So somebody that maybe had a pretty good self-confidence years ago, and all of a sudden they're down.
Yeah, it's changing, and it's interesting. Energy is probably the biggest one, but I had a patient describe it as the lack of So if you're playing a basketball game with your buddies and you score a shot, and they've just lost that. They're kind of like, I don't really care anymore. And so,
you think that's a hormonal issue?
I do in some cases, yeah.
Okay, so let's talk about the man 40 plus today. Or it could be 35 plus, but 40 plus, just as an example. Feeling pretty good, tired maybe a little bit at the end of the day, right? That's normal, okay?
Yeah.
What are the commonly replaced hormones?
So for a man, we look at things like DHEA, testosterone, sometimes pregnenolone or progesterone. We do look at growth hormone. And then we look at some of the metabolites like dihydrotestosterone and androstenedione, prolactin. We want to look at everything together as a balance. Thyroid is very important, and let's not forget the adrenal glands. Adrenal hormones are sort of a foundation for how we feel. And there's a lot of adrenal burnout these days. We are in a stressed, crazy world. We're running from lions, tigers, or bears every day, and we shouldn't be. So we look at that as well, and it's all together.
So on day one at your office, somebody comes in, and do you mostly get healthy people that want to take it up a notch, or do you get people that are sick and feeling lousy?
I do. It's mostly healthy people who want to be well, and that's one of the best things about the practice. It's so different. I used to do primary care only. I worked for Kaiser, UCSD, the military, and you got a lot of patients who just wanted their prescription refilled, and they had all the diseases, all the chronic diseases, diabetes, hypertension, heart disease, and they don't really want to do much. They just want to take a pill. Now I get people who want to be well, and it's wonderful. They want to feel good.
Let's talk about testosterone. And what, men watching this, they're going, I feel pretty good. My libido's pretty good.
Right.
40 years old. Why would they want to do testosterone?
So we take a look at what their levels are, and more importantly, the balance between that and everything else, because it's very, very important now, we know, for cardiovascular disease prevention, wellness into your 90s and 100th year, also brain health. So we want to avoid Alzheimer's disease. We want to keep someone active, keep their bones strong. So the big thing with guys is it's not just about testosterone. It's about testosterone and how it relates to all the other hormones, and then what becomes of the testosterone when their body produces it or we give it to them. So a lot of men are unaware of that, and a lot of men are getting testosterone from their primary care physicians, and nobody's monitoring all that other stuff. And we now know,
like the androgel.
Yeah, exactly. Okay. And we now know that estrogen, in particular estradiol and some of the metabolites of estradiol and estrone, which is another estrogen that we make a lot of as we age, can be implicated in risk for prostate cancer. And so we really, really want to watch the balance of all the hormones together. We can actually make someone healthier and have a lower risk of prostate cancer as they age, as well as a lower risk of heart disease and cognitive decline.
Do you like, do you give creams? And these are all prescription we're talking about.
Of course,
right?
They're all prescriptions.
So topical, injections, what do you do?
So we do pretty much all comers. So it just really depends on the person's individual chemical milieu. We actually use medicines that can be injectable or topical or oral to help stimulate your own testosterone production. And then we use testosterone replacement in an injectable or a cream or gel form. We never usually give testosterone orally. It just tends to inflame the liver and things like that.
Do you see big reversals in the way people feel?
Definitely.
Like every week in your office?
It makes
and
my
so
day.
Give me an example.
It makes my day. Let's see. I'd say the biggest case that I can think of was the guy who is the dentist who was actually, he lives to work. I hope that when I get to be in my 60s, I'll be looking more forward to retirement or doing some other occupation, but this is his thing. He wants to be a dentist, and he works 5 days a week, long days. He's, I think, 73 now, and he came to me 3 or 4 years ago just having that decline in energy, just would nap every afternoon and just be exhausted on the weekends. And he and his wife were very unhappy with the whole thing. No sex drive, no libido, couldn't recover from a gym workout, couldn't maintain muscle mass. Erectile function was an issue. And so he's had a total reversal of all those things. And now he feels like he's got more energy than his, like I said, his 20-year-old dentist right out of school, and he can run circles around them.
What about dangers? People will tell me, they say, Randy, the problem with testosterone
right.
is, because I take testosterone.
Oh, great.
I love
for
it.
you.
I'm exhausted without it. Right?
Yeah, right.
In fact, I felt good. Somebody said, get tested. You're in the mid-range, Randy. You want to be optimal, right?
Right.
I did it. And after about 2 weeks, I'm on fire.
Yeah.
And then when I run out of it, right, I don't get
really
my prescription.
Feel it. Yeah.
I'm dragging. I go, it's the testosterone.
Right.
Okay, but what about the risk? Because everybody says this to me. Because I always say, you don't know what you're missing.
So medical research
but
now.
Prostate cancer, things like that. Comes up
prostate cancer. So there was one study a long, long time ago that was basically a castration study. So they showed no progression of prostate cancer and regression with castration. That's obviously extreme. Nobody does that nowadays. But that study has lingered on in our medical establishment history for all these years, despite the fact that there's all this other literature disproving an association between prostate cancer and testosterone supplementation. In fact, if you look at population studies and you divide guys up into quartiles of testosterone levels, the ones with the lowest levels tend to have the most aggressive prostate cancers if they get it.
Interesting.
And it makes sense because we look at dihydrotestosterone, another component of testosterone breakdown that we look at in our practice. And the guys that have the most dihydrotestosterone, that is a signal to the erectile tissue of the penis and the prostate tissue to grow and become what it's supposed to be. If you take that signal away, then these cells, as you might imagine, could become anything they want to be. And that's what cancer is. Cancer is just basically cells gone wild, not knowing what they're supposed to want to be. So there is actually studies now showing that if you're at an optimal or a youthful range, I'm not talking about big bodybuilding abuse ranges, optimal youthful 20 to 30-year-old ranges, you're going to have less of a risk of prostate cancer. And if you ever get it, it will be less aggressive. The key is you have to look at all hormones together. So
it's not just one thing. And we are out of time, by the way.
Oh,
we have probably 2 minutes at the most. But okay, so we haven't talked about thyroid and DHEA.
Yeah.
Final thoughts about that?
So DHEA is often forgotten, but it's one of the major hormones that declines early in our 20s as we start to age. Has a lot to do with mood, attention, focus, a little bit of libido, fat burning. So it in itself has its own components. And then thyroid is really common. I think almost everyone in my practice, when they reach a certain age, have thyroid decline. So the thyroid ages too. And it's important to be optimal, and it factors into heart disease, strategies and mood and energy and all the things that are important to.
Do you find that the patients, again, we're out of time, but
no problem.
But once they get their hormones at more youthful levels, that they get hooked? That means they can't do it any other way?
Yeah, they really, really miss their hormones when they...
That's not expensive to be on the program, right?
No, it's not expensive. In fact, it's amazing because we use a lot of customized prescriptions from compounding pharmacies, and they're way, way cheaper than actually the commercially prepared versions that are in the retail pharmacies. So yeah, it isn't expensive, and that is a big myth.
If somebody wants you to be their doctor, how do they get started?
So give a call to the office. They come in for their first visit. We usually spend about an hour to an hour and a half with them, full physical, medical history. We go through any labs that they might have had and then examine them and come up with a testing plan to what we need to test. And then we meet back after those results come in. Usually it takes a couple weeks, and come up with an initial program. And then we will follow them up periodically after that. Usually the first couple follow-ups are closer together because we want to make sure everything's in balance and we haven't put them at risk for any hormonal imbalances.
Okay, good. Well, I want to thank you for coming on the show.
Thank you.
Very interesting. Are you on hormones, by the way? Because I know your age. You look much younger than your age.
I am. I don't actually use testosterone. I use some other medicines that boost my natural production, which is something that I like to do. And
secret medicines, or you can tell us?
Oh no. We use things like clomiphene and HCG. Sometimes herbal preparations that include tribulus and things like that. Yeah, because.
What about DHA for you?
DHA, I definitely take that every day, and thyroid.
And thyroid. Well, good. Very interesting. I have a lot more questions, but your website, they can visit your website?
Yes. Yeah, it's drfarnesi.com or manageyourage.com.
I'll put that at the bottom of the screen. Thank you for coming on the show.
Thank
Very
you
good.
so much.
Excellent.
Thank you.
You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you'd like to see this interview again online, you can just go to our website at wellnesshour.com and put in Dr. Farnesi with one S, or just put in San Diego hormones. You'll find them there. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.